Airway pressure release ventilation, APRV, augments carbon dioxide excretion in spontaneously ventilating patients on CPAP. It is a means of changing lung volume between two pressure levels in such a patient. CO2 excretion is altered when lung volume drops from high to low, as CO2-containing gas exits the lungs. Inspiratory and expiratory cycles are really the spontaneous breath cycles. Restoration of high pressure expands the lungs with non-CO2 containing gas. Simply, APRV is a means of helping a spontaneously breathing patient maintain CO2 homeostasis.
Traditional positive pressure ventilation with PEEP reaches critical opening pressure for brief periods at end inspiration, leaving minimal time for volume redistribution. APRV allows continuous airway pressure, providing maximal recruitment as critical opening pressures are exceeded and maintained. The use of APRV in optimizing mean airway pressure and lung volume also provides greater surface area for gas exchange. It is also important to note that allowing for adequate CPAP duration and limiting release time permits only partial emptying of the lung. APRV is associated with less dead space ventilation. The end effect is greater gas distribution in all lung regions, improved oxygenation, and the reduced need for high-minute ventilation.
Graphically, if we look at the expiratory flow pattern, and this is probably the more precise way to set the release time as opposed to arbitrarily picking the numbers, is we really want at least a 25% of the peak expiratory flow trap volume. And as you shorten the release time, this trap volume increases, and you can use this to try to recruit the lung and stabilize the lung. So if you have a patient who you want to try to recruit, as you would by increasing their PEEP, you would shorten the release time, and this would gradually increase the amount of trap volume. And generally 50% of the peak flow is sort of where you maximally shorten the release time.
APRV is a means of helping a spontaneously breathing patient maintain CO2 homeostasis.